so unfortunately we don't have a lot of information to provide. We are connecting with the county, still implementing Avatar, still working with just kind of learning the system and all of that, but that's unfortunately all we have for sharing. I can absolutely take any questions or anything that we can absolutely get back to you guys on if that's something. Not that we have planned just yet. Sorry, what portion? Like just the connecting with the county regarding Avatar, or? Thank you.
Hi, I was like, good morning. What time is it? It's 1. Um, it feels like it's still 9 a.m. Victoria Kelly, Redwood Community Services. I have our data report I'll pass out after, but I think some of the highlights, I was like looking through what, has been going on. This season's a bit wild and crazy for us all, but particularly I think for some of our programs with vacations and taking care of the family needs. But we have recently in probably the past, I don't think we've reported on this, but in the past 4 or 5 months, started to do a different type of group programming with our adult residential sites. And so we bring them together 3 times a week for group work. Sometimes at different spaces, so sometimes at our office, on Orchard, sometimes at our ranch site, sometimes in the community. I had the privilege of seeing some of their activities last month at our site, and it was just full of laughter, and it was fun. And we have a lot of our rehab specialists, skilled and long-time rehab specialists who have worked with children for many, many years, working with this adult population and having a surprising experience in terms of their enjoyment with it. So that's fun. There was something else I thought of updating you on. Now I'm blanking. Oh, I know. We did have a recent DHCS audit at our CRT and had a successful audit with them. And at the same time, we had a audit or interview with UCLA, which the county has engaged in a project. I don't know exactly all the specifics, but we had a interview with UCLA regarding our mobile crisis and our crisis continuum. And they are going to be putting out a report in the upcoming weeks. They're looking at things across the state. And they were very impressed with our programming. They particularly said that one of the factors that they see in our program that they did not see in any of the other interviews was the robust aftercare. And so we're excited to get that report, and I'd love to be able to share that with you hopefully the next time I come. Hopefully we'll get it by then. They had said a couple weeks, but you know how that goes, especially at this time of year. So that's all I have. Other than I think are pretty typical, we see some increase in crisis calls at this time. It's not always a joyful time of year for folks, so we had some positive feedback yesterday, which I passed on to our team regarding relationships on the coast. And our team is meeting with the new chief over there as well, so yeah, things seem to be going pretty well.
Hello, everybody. Brian Erickson, Operations and Development Director at Tapestry Family Services. And I wanted to go through and provide you some data on number of people we serve, number of services that we've done from July 1st through November 30th. Don't be shy, yell out a number. How many services, total services, do you think that we did for Medi-Cal alone during that period of July 1st to November 30th? More. A little bit less. A little bit less. Close. 13,270. Got my handy dandy notes here. So to kind of put that into perspective, if each and every one of those services was a minute, it would take 9.2 days nonstop to represent that total. Or for those of you who know, nice big huge ream of paper, if each piece of paper was an activity, it would be almost 27 reams of paper, which is like 150 pounds of paper. Depending on how long your legs are, what?
I said, I hope you're computerized.
Very much so, yes. Depending on how long your legs are, if you were to take a step for every single one of those, you'd walk between 6 and 7 miles. Or it's almost 80 services a day, including weekends during that time period between July 1st and November 30th. So it's really exciting that we're given the opportunity to help so many people. We are providing services for 789 Medi-Cal clients currently, 962 total for all of the programs that we have. So we're getting close to that 1,000 mark. And also wanted to kind of share an overview of the coast, since it's been now a little over a year since we opened our offices in Fort Bragg, because we have 2 of them. We originally opened in November of 2024, and since then we've served 309 people. 206 of them are actively being seen, and those are clients between Fort Bragg all the way down to Gualala. So we're actually seeing more and more people from the South Coast who are reaching out, whether to get services, us to go to them, or a couple of them actually are coming to our Fort Bragg office. Gina. Youth and adults, yes. Yes, it's the entire range. I think the youngest that we have, I think, is just over, I think, 14 or 15 months. We're doing parent-child interactive therapy with them, doing PCIT with them. I think our oldest that I can remember off the top of my head, I think, is 87. Yes. Yes, we do work with many of the tribes throughout the county. And we actually have one of them who specifically has asked that we come and provide services in their office spaces, so that we're there in the community, a continuation of Hear Us, if you will, just on our own. So they have actually helped with bringing people to the point where they are wanting to get services, and they're showing up, and we're actually utilizing that space with that relationship with the tribe.
And which tribe is that?
There's I know Hopland was offering us a space to come and work with them. We have worked with Caddo in the past and having a space there. But there are others that we have either worked with or are starting up again a relationship. So it's a really important aspect of the work that we do. Yes.
The Chamber of Commerce moved out of the other end of the building. Are you taking over the whole building?
We took over the whole building. It is now officially open, and when you come into our office, instead of going around to the street side, you can go through that main entrance off of the parking lot.
That's not why I was asking, because that was a problem. But no, it's great that you've got that space available.
Definitely. About the grant. It was covered actually in the Mendo Voice, so I'm not sure if everyone got a chance to see that. But we do have a 3-year grant. It's $1 million to provide mental health services for anyone up to the age of 25. And the focus is going to be on the outlying areas primarily, but also those who don't have other access to services. And also there's going to be a fairly large aspect of that program will be PCIT and providing that in remote areas. So we actually just signed the contract to have our van converted over to be an office space. So within the next couple of weeks, we'll actually have it ready to go and be able to provide that service in the community as opposed to people having to come to where we have offices for it. Yeah. So like up in Covelo, Laytonville, Leggett, on the south coast, instead of people having to travel to get to our office to be in that space, this space will be created where we can do that service anywhere.
And the grant was through, I know I saw it, but was that through the state?
No, through a private foundation. Any other questions? Thank you very much. All right. Thank you.
Good job. So, go on to the hospitality center.
Afternoon, Paul Davis with the Hospitality Center over in Fort Bragg. Let's see. We are currently still working on getting our avatar. All the bugs worked out. I think the frontline users are getting their stuff together pretty well. Back office stuff is a little tricky, but I think our billing guy is having a meeting with county staff today to get down the reporting and some of the bugs that they've been experiencing, so it's not going too bad. We are seeing about 45 folks right now in specialty mental health services. We will be having on Tuesday our Wellness Center holiday party. Folks really turn out for that every year, and I think it's probably needed now more than most years. So they will really do it upright, have a lot of fun and activities, and everybody's invited regardless of what services they're using. So other than that, we have some concerns. The Hospitality Center sees primarily homeless and formerly homeless folks, and there are some things coming up that are going to affect them deeply. That starts on January 1st with, CalFresh. I think having enough to eat is a big part of your mental health. So we're fleshing out we've always had a volunteer program for clients, primarily, just to let them feel included and get some work experience and, have something to do every day. And now, a lot of the clients will be facing the necessity for work requirements to keep their SNAP. There are volunteer time provisions there, so we want to make sure that we have staff capacity to allow folks to come in and do things, whatever their level is, and monitor that and be able to sign off on that paperwork so that not too many people are suffering with that. And then there's some stuff coming down from HUD, which is going to affect permanent supportive housing for folks, and that's a big deal to a lot of the people that we're serving. I know that over the years of providing specialty mental health services, we have assisted a fair number of clients in obtaining those vouchers for permanent supportive housing, and so that's under threat. I don't have any solutions today, but I did want to bring it up because you know, there's a percentage of folks that we're serving here that are in that position, and that's going to affect probably the service provision of everybody in this room. So, yeah.
Did I see someplace that you guys are celebrating a 40th anniversary?
Yeah, 2025 was our 40th year in operation. Yeah.
So did you set off any bells and whistles so people knew about it?
Yeah, we've tried. We had an open house, and yeah, we did. Yep.
Any other questions?
Yes. Sure. Well, it's looking like some percentage of current voucher holders will no longer be voucher holders in July. If we don't come up with solutions. So, yeah, that'll affect us at the shelter. That'll affect the shelter over here. Yeah. We operate a transitional housing program, which is since 2017 has been, you know, the target cohort has been folks that are using behavioral health services and families with children. So, but that's self-funded, you know, through what's collected. So. I do. I think that's very important. I think it's the purview of the continuum of care and CDC. So, you know, we will participate in that for sure as we get instruction from them about how they want to move forward with that. But yes, I do. Yeah. Yeah. Yep. Thank you.
Being here, the work. Anchor Health.
Good afternoon, Tim Schrader, Anchor Health Management. Glad to be here today. We've had a lot going on. Our construction for the MHRC is in its final stages, and seems like it's taken forever. But
Can't empathize at all.
there's a number of inspections going on now, and permits and occupancy things and so on. So we are in those wrap-up weeks. We hope to be open in January. We've done interviews for staff, for the rehab worker staff and so on. We have other interviews lined up. And the clinic is doing well and continues to function pretty well. We like our new building pretty much. And so that's pretty much all I have. If there's any additional questions?
So you guys have been, you're using a text system and that's helpful with getting people to fill up the medication appointment?
Yes, that's been helpful. I don't know how helpful really, if we've quantified that or not.
It's not as, we haven't had like a significant improvement, but enough of an improvement to make it worthwhile. So it's made it, the cost is very small compared to what we were losing. So we found we're going to continue to use it, and we can actually see more readily and more, like it's more apparent who may or may not come in that morning. So we have tools now that we can use to be a little bit proactive.
And we're also doing more reach out calls and stuff than we had been.
Because now
I think another thing is that it might be that we're sort of training the staff or the patients to understand that they're going to be getting a text and stuff. So it might take, we might see a little bit of an increase in the success of that too, as it gets to be more familiar to the patient.
the enhanced case management.
Great, really good program. We work hand in hand with them, with the specialty providers every day and with the clinic every day. So they help also get people into appointments for meds management. And so I think overall we're doing basically what we can to get people in. We're interested in people being compliant with their medication regimen.
Before you open for business, are you going to do an open house on the building too?
I think we'll have everybody wants to party.
No, I think.
Yes, we
I
will
would
have
love
some.
to see it.
We will have some sort of I don't know if we're calling it an open house or what, just a ribbon cutting, that kind of thing.
And
Yeah.
that will be in January, I think.
Yeah.
So I think that there's been some questions in the community about LVNs versus psych techs, and I see that your report says that you've had applications for both. So my question is, are you working with MCOE and Mendocino College, and also what is that looking like as those numbers are coming in, or are these local folks, or are these people coming from out of town, or how's that work?
So the answer is yes. So we went to the job fair at the college. We actually have a direct connection at the college for stuff like that. And then for MCOE, we actually do internships with them on occasion, so they know we're available, so that their CNAs and all of that have an opportunity to come in and get direct care. So we're working directly with them. So yes, yeah, but we still are.
And we've also met at the adult center with the graduating LVN class too. So, yeah.
Do you guys, will you guys pay for the grant?
Yeah.
Yeah, okay.
We have I think we've gotten 2 or 3 applications from that group of folks.
Where's the closest psych program? Psych tech program?
Napa.
Sonoma, right?
No, Napa and Eureka, there's
I'm
one
going
in
with Napa.
Eureka also.
But Napa's
With
closer.
College of the Red
I knew
Cross.
Napa was there, I asked for the closest.
Yeah, and Mendocino College has been trying to work with Napa
Yeah.
to develop something and/or be supportive, and there has been a push locally around bringing a psychic program, and yet there is a lot of
Tom Ullman has been really pushing for that.
yes.
So we've also engaged a brokerage, labor brokerage company, I guess you'd say. I'm not sure.
Yeah.
An agency, thank you. Brokerage company doesn't sound right. But
More paper.
Human capital.
and so they are particularly interested in or going to be helping us with the techs. And I think they're based out of Napa, as I recall.
I don't remember.
Napa's been uncooperative with doing a program here, as where College of the Redwood, I mean, I don't know that they're uncooperative, but it's just far away, and they've been less available, and so they were gonna try and do College of the Redwoods. Then there was a survey taken, and they were concerned that there wasn't enough people that would respond and utilize the psych tech program. If there's a need for it, which there, I mean, we got the club unit coming and all of that, maybe we could talk to
Yes.
Thank you for the update. I'll share your job postings on social media and with other friends that are in the medical field, and hopefully you guys are able to find some qualified applicants, because I think you have a really important opportunity, especially for some of our folks that have struggled with their ability to stay in housing, and this is a real opportunity, I think, for some of you to reconnect your community in a meaningful way.
Yeah.
So
Well, thank you. I think I feel very hopeful about this and excited about the challenge. So, okay, thanks.
Thank you. Okay, Karen, you're on.
Right. So for the behavioral health and recovery services programs that are operated, local crisis has seen a pretty consistent and steady request for calls. We average in the 30s to 50s of the number of calls per month, and that's holding pretty steady. RCS is doing the nighttime call out response,
the switchgear come in?
but I don't know if it came in yet, but it was actually coming in earlier than they proposed, so that's
Right.
good news. So, and we all know
No
what a
generator.
switchgear is now, since we all didn't know what it was before, but now we all have been educated on that. So, so the puff is moving along. We did have at the last Measure B meeting, it was nice to have Restag came and spoke to the Measure B committee about their program and how they plan to operate the facility, so working with the juvenile hall and the jail to roll out CalAIM, and create an interconnection between NAFCARE's tech care system and Avatar, so everything automates over and we can do their billing. We're still building everything out as I swear it feels like every day the state's like, oh, and now you guys are going to do this. Oh, and now we're going to add on this new requirement, by the way, you know. So a little bit, a lot going on, but I think we're doing pretty well to keep up with
I
it.
wish I could say that it's gonna even out and it'll all be okay in another couple of months, but it's nothing like it used to be.
I think so too. I think as soon as we get ahead of one thing, there's another thing, and you know, we're moving into DHSA, right? And so even as we're meeting all of some of the other state back-end mandates, we're moving forward with DHSA and centers of excellence and rolling out evidence-based models that counties have to offer. So there's going to be a lot of requirement for the providers to offer evidence-based practices that are at the state level and not just what we're used to offering. So there's going to be pretty big system changes over the next year with kind of what we have to offer and what the outcomes provider as we move forward.
So there's another 3 years before now you're over, and you're gonna do more.
So we'll be doing something else. They'll make a change. They'll decide that this didn't work. We're going to go with this instead.
gotta wear the black jacket all the time.
I don't think I think in 3 years we'll be doing the same thing but doing something else, right?
Something that's
Yeah.
crazy.
Check, that
probably.
didn't work. We'll just revamp everything.
Just keeps us alive.
It does. It does. And I think the state has good intentions of trying to really be able to show the public what's happening and the outcomes for where the money's being spent on. And I think there's good intentions in trying to, how do we have more transparency and what does that look like and really, right.
But not just that, but we seem to get that from all that happens. I think, you know, communication, getting on, even like workshops, not the workshops in school, just for better presentation.
Yeah, I think those are good, and you know, they really will. You know, we get asked a lot of time, how do we compare to other counties? Well, for once, the state can actually show us how we compare to other counties, right? We get asked that a lot, and I'm like, there is nothing. Like for years, there was no way besides talking to other counties, right? So now we can see kind of how we look on our HEDIS measures. We'll really look at the patient outcomes. That's really going to tell you what are the patient outcomes, right? That's the purpose of HEDIS measures, right? To really look at that. And so it's going to allow us to see our HEDIS measures, how our patient outcomes are looking, and then how we compare across other counties, and that will be public for the state to release stuff out and the counties will put stuff out. So a lot of push for that. Yeah.
You're gonna come out looking fine.
Yeah, I'm not worried. I'm not worried. I think we'll look good, and I think that it's good. It's just getting there with all of the changes. I think, you know, at one time we counted up, there was like, I don't know, felt like 75 or 80 new initiatives happening at one time. And, you know, and it's like, they're all great, but within reason, right? You can only do so much. And one director at one point said, are they trying to kill us? Or are they trying to kill us? Because it seems like a lot all at once. So I think there's some good initiatives with good intentions. But it is a lot of change in our system. And I think that's part of why the sanctions are too, right? We want to see change. We want to be compliant. And I think that, you know, yeah, and I think that sometimes, you know, sometimes that's needed, right?
Do you think that part of all this is being proactive with what's happening on the federal level, trying to get in front of it?
No, a lot of this was in place already. I mean, this isn't new. This is guidelines that's been rolled out over the last 2-3 years that we've just had consistent, you know, moving to come in compliance. I think CMS has made some changes of expectations, so therefore that makes, you know, it rolls down into the state and rolls down into the counties to have specific requirements. You know, there's a lot of conversations about what, you know, how are we going to get health information exchange to where they want it so that data can be shared in and see all your services, and then that, will lead hopefully to what I think they're hoping, which is the health information exchange for the data up into the system. So yeah, so a lot happening along that. Um, we do. The Good to Know Mendo. I keep talking about it, so hopefully you guys have checked that out. We're going to keep growing that. We've been working with our epidemiologist on the public health side of the house, who is building a data dashboard for Mendocino County. It'll be live and active, so that you can go in and you can look up different health systems, chronic liver disease, diabetes, different things, overdoses, and it'll allow you to see where we rank, how we rank for, compared to the states. It allows you to look at gender, ethnicity, age, and really see what our health outcomes are in Mendocino County. So we are hoping to have that live in January. It'll be the first real active data dashboard that I've seen in Mendocino County, so we're super excited about that. And then it'll be a good place to really work on what are some of those outcomes and how to reduce them upstream prevention on those outcomes. We are doing the community health needs assessment and the community health improvement project on the public health side. I mentioned that because one of the groups is a focus on mental health and substance use. And so there is a group that is focusing on that. So I think that's just important for you guys to know. They're looking at right now, they're putting together the project with kind of their strategic plan for groups, and working a lot on better education and how to do stigma reduction education within our community in schools. That's a big one. Nothing's finalized yet because they still have to agree on that as a group, but they're working on that. So make sure you check out the Good to Know Mendo. If there's other things you guys feel would be good, let us know. We talked at the last meeting about tablets or laptops, so that everyone, we could get out of paper. And I noticed that we have a whole nother stat. Oh, you didn't mention it today.
I was just hoping
This
and
was,
praying that they were from last month, and I was biting my tongue.
I don't know if they are, but we're not answering that question today for you. So no. So we did talk about moving away from paper copies. Of course, we would still have a couple paper copies in the room for the public, and if someone, needed one, we can also mail them out for anybody who prefers paper copies. But to get away from how much we are spending on paper and ink, and then we throw it away after every meeting, we talked about laptops, or tablets. Working with IT, they thought some form of tablet would be really easy with a keyboard for you guys, for everyone, and that it would be probably more cost effective. I would need you guys to vote to move forward with that way. Dustin was thinking about 2,500 to 3,000 to get enough tablets for everybody in this room, and they would just be set up for when you come in. You could log in, set up, and access everything here on site. They wouldn't be free to take home, but they would be used here so that you could go through the material on site and not have to have a paper copy. I know a couple individuals noted they could just bring their own, so that's also another option, and we could just order some for those individuals that prefer to utilize one here. But I would need to know what you guys are thinking, and if you want to move forward, we would need a motion and approval to move forward.
Are these laptops something that would just, like we have our own AV, this would be just for our
It would only
board?
be for this board.
I have a question. How do you feel about the tablet? Do you think it's a good idea? I
I
know what
do.
mode.
No, I actually think it would be beneficial. I think it would save staff time from making multiple copies.
Like they have nothing else to
Yeah,
do.
they have nothing. Yeah. We'll find more jobs for them since we're taking away their copying jobs. But no, I think it's beneficial. I think it would cut down on, it would save costs, and because it is we don't even include, think about all the ink we utilize in addition to the paper. It is, yeah, and then we end up recycling
just gonna go, we're gonna be going through a change, not all of us have tablets, and that way we'll have the consistency of all working with the same specific equipment.
I just wanna make sure that you put it in the vote that it's.
Yeah, I think that getting the 10 tablets is a good idea for like what you're saying for, but like I don't need a login. We don't need to create extra IT work either to create logins for people who aren't going to need one.
We'll just have a guest login.
Oh, okay.
Yeah, it'll just be a guest login for each one. It'll be the same, but
Okay.
if you don't need to utilize it.
Yeah.
that's fine.
Okay.
And then if she isn't going to use it, then there's a backup user.
We're getting somewhere.
Okay.
Pretty soon we'll actually
Good.
get you guys to take a picture.
She's just gonna keep saying it at every meeting.
What? No, I gotta wear them down.
What, or is everybody opposed to a picture? Or is just because nobody's ever all here?
No, people have been people have been opposed. And the
In, not in the, yeah, just for the group.
A group photo. You should add, yeah. Yeah.
right.
That's what I'm trying not to use too much money because the county is constantly crying for, and that's why we meet here.
Your money is my money.
Yeah.
I know, but
Just keep telling people that.
I would
Yeah.
rather see the money used for something other than a room. You know,
We
that's
talk
why
about
we're
that later.
meeting here instead of the Redwood Valley.
So well, maybe we'll in January we'll plan to do pictures that look aggressive or aggressive at the group pictures.
So you can show up looking presentable.
Yeah.
When we get everybody new, we'll just do it.
There you go.
Yeah. Okay. So, can I call for a roll call?
Yeah. I think Anthony, you're first. Joe,
Yes.
Mark, Denise, Harry, and Gina.
It unanimously passes, so. You can put bows on it and give it to all of us for the holidays.
Don't spend the extra money for the bow.
All right. So, are you happy with your report? We're done? No, do you have more?
I always have more, Joe, but I'm good.
All right. So, MHSA annual update.
All right, so this is me again instead of Rena. Slight adjustment, but since I was going to be here, figured no need for three of us to be here. Just as a reminder, this is a request that the New Behavioral Health Advisory Board open the public comment hearing. In the last meeting, you opened the public comment period, but we'll take a few minutes during this meeting to hear any public comment that wants to be shared verbally. The public comment period has been open since the last meeting. We have not received any comments specific to the public comment period yet. This is for a mid-year update to the 25-26 annual plan for MHSA. Whenever we make substantive content changes, it has to go through a new public comment period and hearing, and so that's why we're doing this. The summary of the changes are on page 6 of 180 of the plan. And unfortunately, this is just we got some recommendations from the state to just add some additional detail. There's really no substantive changes to the intent of the plan. This is additional detail about cost per client. It's additional detail about the budget by year, even though in our budget planning we do the same allocations for all 3 years with the expectation that if there's changes, we'll make those mid-year, and those are reflected in the summary for each year, not the plan. So there isn't real substantive content change, but there is some additional detail prior to the existing annual plan as far as by component PEI in particular, how some of the things were expended. So I will be quiet for a few moments and hear any public
but I look in my paper every week, and he is always writing in the paper, and it's nothing yet positive. He is, that's what the ABA does.
Do you guys want this in public comment, or do you want to close public comment and have a conversation?
Answer the list.
Yeah, we can close
Okay, we can,
Should we close public comment? and
It
then
seems
maybe-
like we're not really talking about the MHSA plan, we're
Yeah.
kind of on,
no.
on puff and,
Yeah.
the ADA.
So let's close public comment.
Yeah.
Anything more?
So
Obviously,
Karen's not having to write everything down and say.
but you could put down that the presence needs to be.
I will absolutely, I did capture and will include the comment that we need to educate the reporter in the details that Denise mentioned, that there were comments in the quality assurance or the QAPI meeting regarding a request for information about the process in Jennifer, and a request for information about Burley County and Advocate Care.
So public comment is now closed. Thank you, Karen. And yes, we all get a little, this is, I was gonna reply to this. And I think I talked about that at Measure B. And the consensus was that replying to him isn't gonna do any good anyway. And, right, and so, and I shared this with them, that I think you don't make it in this county unless they write you up in the ABA.
Oh, I
So-
think it's like, continuum care, CSOC. Um, they were getting criticism all over the place for all the homeless on the street.
They still
And
are.
so this was the same
Yeah.
comment I made to them. You need to take this data and put it in the paper and show how it's been reduced, and that they've made a big difference with, homeless on the street. But you can't force everybody to be in housing. That's not how it works.
That's what's not understood. The other thing is, I have found it to be completely frustrating to put something out for the press, and they don't choose to pick it up. Oh. And if they do pick it up, it might be buried in the back where they need to fill a space. And to us, it's really important, and to them, it doesn't sell papers. So, and then where do you put it online? If they're looking at the county behavioral health, I mean, that's where I see stuff on the Facebook one, and I don't use Instagram or anything else.
We do really good if we put it on, usually Roseanne is our social media. It's another one of her titles.
I was gonna say, which crown is that?
Yeah, Roseanne is our social media communications expert. But usually if we put it on Facebook, she puts it on Instagram and Twitter. Yeah. So we try to put everything on, we copy everything. Usually if she posts it once, she posts it everywhere. And then sometimes we'll cross-post between the public health pages and behavioral health pages if they cross over to try to get that information out.
Yeah.
Would you do a presentation to the South Ukiah Rotary Club?
Yes.
Maybe we could get you on the program to do a Measure B report.
Yeah, I can
Because
take that
That's
to the
a broad
next meeting.
spectrum of the business community, and we had one member that were always complaining about the homeless because of our facility on Goby Street. She was seeing the homeless coming. Well, I drive down that street all the time, and I don't see a ruckus going on. I mean, it's peaceful and whatever, but I think it's important to some of those people that have negative ideas hear from us.
And I
That's a
think,
good way to do it.
I think Rotary on the Coast needs, if you're talking.
Any Rotary Club.
Right, so, I mean, if it's
If-
gonna impact the
And if
county.
I've been invited, I've come to the South Ukiah Rotary, I think twice now, over probably 2 years, 3 years. They've invited me twice to speak about our services, and so I've gone twice and spoke at the meetings in the morning.
Tim Bosma's wife is very active in the Rotary Fort Bragg. And I also have people I know in Mendocino. I don't know if, there must be a Rotary in the South Coast, maybe not. but if, anybody wants this agendized for next month or February, is that, I know Perry does, anybody else think that's a good idea? Discussion, okay. Thank you. All right, so,
You guys are like the contrast of each other.
Going, what? All right,
Bradley.
okay.
Before we leave that item, I do think we actually have to vote to close the public comment period and give
I know,
MHSA
this
permission
is
to.
my first time dealing with it, so
Okay.
yes,
Yeah.
yeah. Just hit
No,
me over the
I
head, it
forgot
works.
to.
I make a motion that we close the public comment period.
Okay.
Anthony,
And-
Perry,
Yes.
Mark, Gina,
Yes.
Denise.
Yes.
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 Thank you.
Yeah.
It works. Thank you, Karen. And thank you, Dr. Miller, for this. All righty. Board and committee reports, discussion and possible action. You all received in your packet the draft schedule for, I just misplaced it, the draft schedule for our meetings for next year. Does anybody have any comments, questions,
It's at the very back.
conflicts?
It's like the
back.
second
Here
to
we go.
last page. Yeah.
Yeah, like we got a whole book. Oh, I gotta remind Mo. She's
Complain about how we gotta look. Oh.
I'm trying to just end out the year without being so, guys,
we want you here.
let me keep my mouth shut in peace. Shoot.
Okay, so is there anything from anybody on this? And do we already have for sure the room at Coppola set up and the room in Mendocino set up the same as? Pardon me? Okay, but this is what we'd like to do. Okay. The only thing. Yes. So was there are conflicts, and then the other thing that we have discussed is that when we are in Mendocino or Cobolo, that those of you that are, working and can't take a whole day off for these meetings to just drive, we'll have it set up here and where we are meeting. And we have to have a quorum in one place.
Yeah, we need to talk to the Brown Act regs are changing in
Yeah, that's-
January.
I thought she said that you could form a quorum, virtually and in
Yes.
person.
That's why
In
we're
the
going
new
to-
law, in the new act.
I'm so glad you were there,
Uh-huh.
because
Yeah.
that was one of the questions. So, as long as you're here
Yes.
and here and
there.
Covelo, for instance.
Right.
Yes.
Correct. But it also makes it so we can have a quorum.
Yeah.
And,
If you're by yourself.
right. And that has loosened a little bit, but I don't want to press it. Because you guys, I'm looking at the two of you, and you also are still working, and you can't make these meetings because, of the trek. I usually have to get a hotel room the night before driving that far because, yeah.
Is there a hotel in Cobolo?
Yeah, there is actually a, they pay,
Yeah,
they
there
pay
is.
their GOG and their bid too.
Oh.
So,
I just know looking at the dates, I have conflict in 2 of them.
Yeah, I do
So,
too.
ahead of time.
which months?
The March
Yes.
Yes.
Okay, perfect,
Yes.
yeah, that's what I'm curious.
I was gonna also ask if that was reminder for them to go on calendar. That's the chair.
You're really pushing it.
it.
Calendar's great.
All right. So can we please, do I have a motion to accept this calendar with, with changes, with possible changes depending on schedules?
And I second that.
Okey-doke.
I know it's been on the calendar.
All right.
Do you need a full vote? Yeah?
We,
All right.
yeah, it's a motion,
Anthony.
and, yeah,
Yes.
sorry.
Gina? Mark? Carrie? Me, yes. Denise?
Yes. Yes.
Oh, yeah, Joe.
Okay, so thank you for that. And please get your information into Dobby if you know there's gonna be a problem. Alrighty, then, back to this again. Nominations for offices.
So we had only two nominations, one for chair and one for vice chair. And the nomination for chair was Joe, and the nomination for vice chair was Bo. We didn't have anyone for secretary or treasurer. Sorry, Jen. But
It only gave me the option to vote for myself.
no, we changed it.
Oh, I
You
must
could-
have missed it.
Yeah, we
Yeah,
sent it back out.
okay,
'Cause
I was like, I
second
don't want to vote for myself. I want to vote for somebody else.
You got two emails. Or two. That means you have to stay, as I learned.
So those are, so you guys will need to take a vote unless there's another nominee that didn't put it in that wants to be chair or vice chair. And we do need someone to volunteer as secretary. You could have voted for yourself.
I didn't want to.
Oh.
Was such a tough
You like
job.
somebody else to?
It's not that big of a deal. I will volunteer to do it again if everybody agrees. If nobody else wants it. But it's open if somebody else wants to do it.
You can vote on that right now.
Okay. So you're making a motion?
Making a motion.
Okay, do I hear a second?
Secretary treasurer, anyone second?
We go so much with, we don't even,
Anthony did one. We need a second for Jen.
I called for a second.
Oh, I'll second.
Okay.
Take a roll call vote.
All right, Anthony.
Yes.
Gina. Mark. Carrie.
Yes.
Denise.
Yes.
Joe.
Yes.
You
but
don't.
yes.
You don't know.
Oh, I'm very,
Are you voting for yourself?
I guess, yeah. I guess.
well, we appreciate it.
Here we go.
We've made it really easy for you, Jen, though.
Yeah, you really do.
That,
Thank
that is-
goodness.
Right, we need a motion and a second for vice chair.
I'll move.
Okay.
Yeah.
We can't do it. Okay, so I need a motion for vice chair,
Carrie just
please.
did.
Make a motion that we certify that we nominate Bo for vice chair.
And I'll second it.
I'll third it.
You want
Full vote.
any
Anthony?
Yes.
conversation?
Gina?
Yep.
Mark? Carrie?
Yes.
Me, yes. Denise?
Yes.
Joe?
Yes.
Okay.
She can't even vote.
I make a motion that we nominate Joe Bradley for chair.
I second.
Anthony?
Yes.
Gina?
Yep.
Mark? Carrie?
Yes.
Yes. Denise?
Yeah, I'll do it again.
That was wonderful.
Yeah. Yeah,
Wonderful, because you didn't get appointed to anything.
next time.
Next time, Anthony. Next
Yeah.
time.
I already got a lot on my plate.
We could split the treasurer.
Yeah, but that's such a huge job. You know, but we never know.
Oh, you're secretary and treasurer. Congrats.
All right.
It
So
says
you
it.
know you're the kid in the
Says
group. All righty.
It sounds very hefty.
just as a reminder that the board switches assignments each year, so we'll do that at our first meeting in January. Right now, I assume I will still be the DTAB appointee, but I always like to warn people on all the boards that I'm on that I can get thrown off at any moment.
Well, I think we had this discussion last month, and Mr. Norvell was there at the same time.
Yeah, he was feeling confident, but you never know what's going to happen on the dais, Joe. I go there so often, and you don't know. You got to wait until the day elects. And not even the day. You got to wait until the vote happens.
So this is not even the end of the
That's
story.
Okay. Anything?
So then what happens if you don't get voted back? Do we pick a new vice chair? Do you show up as a community member and be the vice chair?
But then you get a vote.
Yeah, I don't know. That's a great question. We'll have to cross that bridge when we get there.
But if you were just a regular member, you would get a vote.
She'd be the vice chair.
Yeah, I don't know.
Yeah. We can nominate Goody for that.
But none of it's gonna happen, so this is fine.
Okay. And Janet, do you have anything to say?
No, I think I already said it. I did really enjoy though. That was the first time I'd seen the communication about the quality and PI. That was really good. I really enjoyed going to that. I also enjoyed. I need to pay better attention to my email list because Cal BHC or whatever, they send quite a bit. I actually did. I shared my work email because I'm in that so much more than I'm in my personal email. Because I also liked attending the Brown Act thing.
I was amazed how well that went.
Yeah.
And then they said there were 500 people on it.
Yeah.
And it was like, holy cow.
Yeah. So it's keep sharing because I find those things very interesting.
And we do quarterly, during the quarterly, QAPIs, the MHSA, everyone votes on, but we rotate around the county.
Yeah.
So I have some friends on the South Coast, some friends over here,
It was a decent turnout too. Good.
we tried to make them more relevant. For a while it was hard to get people, but we tried to make it, it's a lot of data and where we're at and what's going on.
Yeah, a lot of good stuff. Yeah.
It's amazing. But that Brown Act trending sheet for how many I've been through, and they've always been in person. That was the first one I attended with Zoom. And she still got it across, and you still got your questions answered.
She was very patient.
Yeah, that was Teresa.
Yeah.
So-
Teresa was very patient. She's perfect for that role.
Okey-doke. Going forward, we're at item 13. The Cal BHDC dues invoice change of address. Do we want to do this? Is this something you would like to speak to, Dr. Miller?
So this is your guys', you guys always have done this, it's, kind of your dues to belong to the association. You guys could decide you don't wanna belong to the association, but, you guys have always belonged to the association, and so we always bring it forward. It's your guys' decision on whether you wanna stay in the association, and then obviously we need approval to pay the invoice if you wanna stay in the association. So, we would need, a motion and a vote, so to pay the invoice. What about this?
All right.
Somebody send me $10,000
Anthony
now.
first it and I second it.
Okay, is there any more discussion on this? And I think this is worth it. I think we get a lot of input. All right, so is there any other discussion on this, other than between the two of you?
No other discussion.
You can't put these two together.
I know.
No,
I did notice that.
I think I'm.
You're going back over in between.
Anthony's
We're
the
gonna
problem.
we're gonna put a chair in the
well,
corner.
she said she was gonna make sure you
I know.
behave, and she's contributing.
Yep, to the delinquency of the youngest one in the group.
Sorry.
You did.
Okay, so we have a motion and a second.
A full vote.
We have to vote.
Anthony? Gina?
Yes. Mark? Carrie?
Yes.
Yes.
put on next month's agenda? Well, other than the discussion about the ADA. Yeah. What'd you say?
MHSA will be back for next year's plan soon, because we're right.
Yeah.
Our public comment cycle will start again for next.
Woohoo!
Next time we'll have it electronically. Yes, yes, you will.
How long does it take to get,
It's not live streaming, it's recorded and uploaded.
how long does it take to get our, the tablets if they order them?
If we get them ordered, it depends on IT, but we probably will have them back by January. But the next MHSA plan won't be in January. Yeah, yeah. We'll be bringing it back in January.
Alright, so my only comment is whatever you celebrate, let's have a decent holiday season and get rid of the year 2025. I'm exhausted, I don't even want to turn on the news anymore, so. So do I hear a motion to adjourn?
I make a motion.
Okay.
We're gonna need a tally of how many motions to adjourn.
As you're running out the door.
Today.